Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Trishna as a Vyadhi in last lecture and we had discussed how to deal with the Trishna as a Vyadhi. I also told you that I have seen very few patients which come as a Trishna Vyadhi, but Trishna as a symptom is very commonly seen in variety of diseases. So, in today's lecture, we will deal with the Trishna as a symptom in a Vyadhi, in the different types of Vyadhi. This lecture I think is very important because this will guide you how a symptom is deal with a different in different diseases. The symptom is common in the variety of diseases, but the treatment of the same symptom which is common in the various diseases differs totally according to the samprapti of that disease, and you have to deal the such a symptom with the mainline treatment of the disease. So this lecture is a sample I am putting in front of you, or a specimen lecture, that how a symptom treatment of a symptom differs according to the diseases, and you have to think it in every case very minutely, and then give the treatment for that symptom with that disease. Now let us take example. You have a patient of Vatajakas in front of you, a patient of Kafajakas, third patient is of Ajirna, fourth patient is of Jvara, then one patient is of Atisar, one of Udara, and one of Prameya. And just taking examples of this variety of diseases. Now all these patients are complaining with other symptoms. They have Trishna, and please deal with that because it is not tolerable. Now in the first two patients of Vatajakas and Kafajakas, you have to deal with the warm water obviously, because Ushna Jala is Vatakafagna and Shita Jala will make the dosha prakop of Vat as well as Kapha. So in case of Vatajakas or Kafajakas, to reduce the Trishna, you have to deal with the warm water as a main line of treatment. If a patient comes with the Pitta Jagas, as I have told you in previous lectures that Pitta Jagas is very rare, and I have given the logical reasons behind that. You can go with that lectures. If in any case a Pitta Jagas comes to you, then because of Ushna guna of Pitta, you have to deal with the cold water. So according to dosha, the first treatment of Trishna in these caste patients, for Vataja and Kafaja, you deal with warm water. For Pittaja, if you see anywhere, then with the cold water. A patient next is of Ajirna. He has eaten a variety of foods and some oily food, and now he is complaining of Trishna. Now in this case, you have to deal with the Ama, because that Ama Nirmiti is creating Trishna, and here again cold water is contraindicated because it is Ama Vruddhikara. Again you have to deal with the Ushna Jal for Ama digestion. In case of Jvara, again same thing, there is Tibira Agnimandir, Amotpatti and then Jvara. So in Jvara, for that Trishna, you have to deal with the Amapachan, Agnivardhan, and again cold Shita Jala is contraindicated. You have to deal with the Ushna Jala. A patient next is of Atisar. Now what is the case here? There is Jaladhatu Kshaya because of Rasakshaya, because of loose motions, and now body is demanding that deficit of the water content which body has lost. So here you have to deal with the first Hetu Parivarjan of for Trishna, stop the loose motions either by Sangrahi Karma or Stambhan Karma, and the deficit of Rasakshaya or Jalakshay is to be corrected. So in that case, if there is some Atisar, again you have to give the warm water sip by sip, and if it is Niramadisar and Agni is proper, then you can go with the cold water. The next patient you are treating is of Udara. Now in Udara, water is already contraindicated, totally contraindicated, and Dugdhapan is suggested in the Grantha. So in this case, for Trishna, you have to deal with the Dugdhapan, and the accumulation of water present in the Udara cavity or abdomen is to be excited by Virechana, and you know all that treatment of Agni. Now here again Trishna is a symptom, but water is contraindicated. Up to this point we have seen a cold water, warm water indication, but in this Trishna symptom, the water itself is a contraindicated and you have to deal with the Dugdha. So why this difference came? Because of the samprapti of the background disease. Now patient is suffering from prameha, and you will find that it is a very dominant symptom that patient gets thirsty. What is the reason? The other symptom of common symptom prameha which we use for diagnosis is prabhuta avilamutrata. There is excessive urination throughout the day and especially at the night. Now this excessive excretion of the urine again will create a deficit of jaladhatu in the body, and body will demand in the form of Trishna. So what you have to deal with in this patient? You have to deal with the Mutra Sangrahana Gana, stop the excessive urination, stop the loss of water through the urination. When Jalana Dhatu is retained in the body, automatically Trishna symptom will be relieved because body will not demand water in that case. Of course, you have to deal with the Chikitsa of Prameha along with this Mutra Sangrahana Dravya, what is Kledanashan, Agnivardhan, Dhatvadivardhan, etc. So, in the case of Prameha, you have to deal with Mutra Sangrahana Gana for the Trishna. If you do not deal with this and if you just ask the patient to drink water if he is thirsty, that water is also going to be excreted. So, it will be no use or as a permanent remedy in such patients. So, Kasa, Jwara, Ajirna, Udara, Atisara, Prameha, all these commonly found diseases have Trishna as a common symptom. Patient also tells you that I am very thirsty, and in every case you have to deal with the different dravyas and different form of water to cure it. This is the main thing I want to tell you, that symptom is same but treatment of that symptom differs according to the main samprapti of the disease. I will add some other diseases mainly after cancer surgery or radiation therapy in the oropharyngeal region. Because of radiation there is total dryness of the salivary glands and there is no saliva, and the patient is always thirsty. These patients are very rare, critical to cure because the main glands which are operating the saliva and keeping the mouth moist are not working properly now. So in that case you have to ask, instead of drinking the water, you go inside the stomach, and problem is local dryness. So ask the patient to choose something which will keep the mouth moist. So this is an example of the Trishna as a symptom in different diseases and their treatment according to disease. Now all this discussion is at Sharir level. I will add Manas Hetu inside that. Where patient is in the fearful condition, maybe reason anything maybe, in that case he also founds dryness of mouth. In that case you have to deal with the Sharir Chikitsa or keeping the some moist, to chew the some like chocolates or something and to keep the moist, but you have to counsel the patient at psychological level also. So in that case, in these patients, you have to keep in mind if there is any Manasa Hetu which is creating this Trishna symptom. The another Trishna which very difficult to treat, but it should be uh, treated not with the doctor only but with the patient also is Manasa Trishna. I am talking about the greed. And in today's materialistic world, the greed of the human are limitless. So that greed also creates many problems. We will talk about this in the Manas Rog when we will go into topic. But this Manas Trishna in today's world is really difficult to take care, and for that Satvavaya Chikitsa, counseling are also may be required. Thank you very much.